And we're live.
Are we live?
I think we are
This is so
just
exciting.
about live.
My father is texting me. Hold on. Okay.
Oh,
All right.
now
Now
we
we're
are
live.
certainly live. Wow, this is so exciting. Our
Yeah.
first Facebook Live video.
Hopefully not many after this, but I guess maybe we can keep it up.
Maybe.
Do a little monthly thing.
Yeah.
We'll get together, a little coffee date.
We'll let the people decide. How
We
about
will.
that?
We will let all the people here decide.
Yep.
Amazing.
Yeah. It's certainly not the open house that we had originally hoped for when we decided to make this program.
We had envisioned something slightly different with a few more cupcakes and regular cakes. Really just a whole cake menagerie.
A lot of cakes was our hope.
It was almost entirely cakes.
Yeah.
If we're being honest. Anyways, let's jump into it.
Let's
shall
do
we?
it. Let's do it.
So, hello and welcome to our virtual open house. My name is Cortland Mather-Suter. I'm the managing partner of Colorado Medication Assisted Recovery, or CMAR, because the name is an absolute mouthful. And this is our clinical director,
Yep.
Michael Demoli, LSW CSAT,
Yep.
all the alphabet soup.
LCSW.
LCSW.
Don't short me on
CSAT.
that C.
Sorry. So we're here to introduce you to our program, our services, and the value that we believe we are bringing to the Colorado treatment community. Before we start, if you have any questions, please feel free to throw them up on the chat line, or you can wait until we're finished and we'll create time for a Q&A. But so with that, Michael, if you don't mind, could you share what CMAR is?
I don't mind at all. So CMAR is a licensed outpatient, recovery-oriented, clinically driven, medication-assisted recovery program. So what that means, we are a program specifically designed to treat opiate-dependent population, along with those with opiate use disorders and co-occurring, other substance dependencies, mental health conditions, anything and everything that goes along with that. So to kind of make it short, we integrate structured medical, clinical, and peer-based care to ensure that each patient benefits from a more comprehensive recovery approach than they would get from just general MAT treatment and maybe an office-based medical program. So our clinical team's led by myself, as you said. I'm an LCSW. And we also have Dr. Nathaniel Moore. He's a board-certified addictionologist. We have a nurse practitioner who is certified and trained in Suboxone providing. We'll have some other medical providers, and certainly a growing team of clinicians to support us on the clinical end as time goes on. So, our main services, as I said, are the MAT, the medical care. Our providers are very much ready and willing to provide full medical care to our patients, same that they get any kind of family health care program. And then clinically, it's going to be, a lot of group therapy with a very peer-driven concept behind it, as well as individual counseling, case management, and family therapy.
Yeah, so we firmly believe, from a philosophical standpoint, we firmly believe that recovery is more than just a medication, and that it really has to be. Although we do prescribe buprenorphine-based medications, we take a completely individualized medical, clinical, and social approach to treatment. And that's completely without exception. We never just write a prescription and then send a patient on their way. We also don't carry or prescribe methadone. We're buprenorphine only. So Michael, why don't you share a little bit about what treatment at CMAR looks like?
Yeah, absolutely. Any good treatment begins with assessment. So that's going to be both, assessments over the phone, making sure that the patients that we're bringing into our center are appropriate for us. But once that kind of front end assessment happens, they'll come in and they'll have a full medical workup with our medical providers, physicals, infectious disease screens, blood tests, the whole kind of medical screening that we can put them through, as well as a complete clinical screening to kind of start that clinical process to figure out what their needs are, what kind of services we can provide them. And once that is complete, and once we're sure that a patient is really appropriate for MAT treatment, because not all opiate users or abusers are really great candidates for MAT, but those who are, then we'll go through a process that we call induction. And induction is an outpatient medical procedure very similar to detox, but what we're doing is we're taking them off of whatever the opiate is that they're currently using, whether that is heroin or fentanyl or illicit opiates, or the prescribed pain pills, whatever that is. We'll take them off of that and we'll transition them to buprenorphine, which is a safer medication for long-term opiate maintenance within an addiction treatment protocol. So that's usually a day-long process, induction. Once that's complete, then they'll start in our clinical program with a program that's individually designed for them. So as I said, the group therapy, individual therapy, case management, family therapy, whatever they need on that sort of outpatient basis to get them kick-started into recovery.
Fantastic. Thank you. So we provide treatment in two settings. We have our primary clinic, which is in Thornton, and then we also have a remote version of our program. So our location in Thornton is just over the Denver line. We're about 5 minutes from the North Denver neighborhoods, 5 minutes from Arvada, 5 minutes from Westminster, and then in the 10 to 12 minute range, depending on traffic. We are very close to downtown Denver, Broomfield, Lafayette, and Wheat Ridge. So we're really centrally located in the North Metro area. And with our remote service, that is available through HIPAA-compliant telehealth. And that version of our program still combines the entire medical, the complete clinical, as well as the accountability piece with urinalysis, peer-based services. So it's really just a distance version of that same program, really to both respect people's needs during this COVID period, but also equally important, there are plenty of community, members of our community that have mobility issues, plenty of people in our community that are not, they're in more rural areas, and say they get out of a primary treatment program and have to head back to one of the more rural areas of Colorado where overdose rates are the worst. We don't want to not have them have access to the same quality of care that we are able to provide in person. So with respect to cost, primarily we're an insurance-based program, and we're going through that process. We recently started that process. So although we unfortunately can't accept Medicaid, we can essentially work with any private policy. In fact, because of our unique set of licenses, because we hold both a controlled substance license and a clinical ASAM level 2.1 and 1, which is really just IOP and outpatient, we are essentially able to do, if we can't accept somebody's insurance and it's private insurance, we can almost always do a single case agreement. We're also working on contracts with Kaiser and TRICARE in the hopes of really making this as an accessible program as possible. And we also do hope to build a program down the line that will accept Medicaid. So we offer partial sliding scales for self-pay. We have limited scholarship funds. We accept probation and other state and federal government department stipends. So we are as accessible as we can possibly be while still providing a really truly robust set of services that are otherwise frankly not available in Colorado, particularly the metro area. So just another brief piece. I know this is not the most exciting part of our of the information we're sharing, but with respect to COVID, as we said earlier, we offer a full program remotely, but we also have policies that mandate that everybody entering the facility submits to a no-touch temperature check. We have masks and sanitizers available to patients. and staff at any time. Masks are always required to be worn, and a disinfecting sanitization protocol consistent with CDC guidelines and directives are in place as well. So it is as extremely safe as we could possibly get, and we stand by that completely. So so with that, I think we've certainly given an overview. Do you have more that you want to share? Any burning desires?
Donna, appreciate you showing up and asking us a question. What inspired us to do more than a typical MAP program with 15-minute case management sessions? That's a great question. And, it's 100% the reason that we decided to do this. We're big believers in MAT, and I think there's a lot of physicians and practices around Colorado and the country that provide that service, provide the medication, and oftentimes they make referrals for therapy and referrals for other services that are also important. And I don't want to knock that, because I think it really is vital, and I'd rather see an opiate user be on MAT than continuing to use street drugs or unsafely abuse other drugs. And it's a huge problem in our country.
And the overdose risk inherent.
I always think there's a statistic that boggles my mind is, the overdose quantity in our country is around 60,000 people a year pass away from opiate overdoses. And that's about as many Americans that we lost in the Vietnam War, that we're losing every year to this epidemic. And Cortland and I, our experience in the field has taught us so much about the other side of addiction treatment, the importance of counseling and community. And so many people who just receive MAT from their doctor's offices are missing out on that really important piece of clinical and resolving their traumas, resolving mental health issues, learning new coping skills, and certainly, I think above all else, is building that community and that culture of recovery and support that's so important. So,
Sorry. Well, I think, just like how we totally believe, and Michael alluded to this earlier, that we're fans of any approach that works, and we really believe that people, your first time in treatment shouldn't necessarily be with medication-assisted treatment. If you can do it completely and heal in every facet of your life through non-medical means, that is an absolutely beautiful thing, and we want to promote and support that as much as we can. For folks with more complex needs who perhaps for whatever reason aren't able to achieve abstinence initially, or the complications of their circumstances are such that it isn't a practical opportunity, they deserve more than just a medication, which, as Michael also alluded to earlier, is quite frequently what people are getting. They call it medication-assisted treatment, but often it's just medication-assisted blank. And we are really here to build that in. What we like to call the service is medication-assisted recovery, because of how often medication-assisted treatment is just medication. And I think that really speaks to the aim of our program, and what brought us to actually answer your question, Dada. Sorry. What brought us to the place where we wanted to do that was, frankly, through research, close research in the area, throughout Metro Denver, discovering that although there are some incredible programs and physicians doing really great work, the majority of folks with an X waiver don't also have access. And an X waiver is the waiver that enables you to prescribe medication-assisted treatment drugs. For those folks, that most of them in the state, around 90% in our particular area, they don't have access to a clinical team, to a psychologist, to a therapist, to all of the pieces that really make a medication-assisted treatment program involve the treatment side of the piece. So what we were really drawn to was this idea that we could develop something and offer something in the area that would empower people to achieve something that maybe they can't achieve right now because of the services, because of the alternatives that exist. In those cases, again, where people have a more complex situation, where they have a chronic relapse history, where they've overdosed a number of times, and where even just strictly buprenorphine has not done the trick because of trauma, family systems issues, relational issues, behavioral health issues, mental health. The list is endless of what can lead somebody, even with buprenorphine in their system, back out into the world of drugs or just general unhealthy behavior, right? Where somebody is clean, but their anger is still palpable, or they don't sleep, or they have major anxiety issues that are only increasing with time. That is who we are here to heal, and that is what drew us into this area.
Yeah. Well, we hope to be the place in Colorado to easily, ethically, and responsibly refer opiate-dependent patients. And as time goes on, we hope that we can work with a lot of you and support you all in your practices, the work that you do. Please reach out if you'd like some more information. Leave your information there in the comment box. We'll reach out. We'd be happy to schedule tours, Zoom chats, send brochures to offices, whatever that might look like. So our number is 720-778-2627.
Which is Seymour.
Which is 720-778-Seymour. Yep.
That's his idea.
It was my idea. We got lucky on the phone number. You could also email us at michael@colorado-recovery.com or cortland@colorado-recovery.com, or visit our website, colorado-recovery.com.
And please follow us on Facebook. We're also on LinkedIn and Instagram,
all those fun things.
Yeah. Please reach out, and we really appreciate you joining us today. And we promised we'd be brief, and oh no, we've got another question. Okay, so let's. I say we answer this one.
Let's do it.
Okay. So the question is, I heard that you work with insurance and are working contracts credentialing. If I have a self-pay referral, what is the cost they are looking at? So our flat cash pay price per month for the first 90 days is $38.50. So that is, we purposefully put that under quite a few private programs that are providing a more clinically driven service, because we recognize that definitely folks that need the treatment that we're providing are probably coming out of a primary program. They've probably spent a lot of what if any that they had, and so we wanted to make it as accessible as possible. But like I said, we also are we can absolutely slide the scale. We can work with what is that word? Oh gosh, my mind just went blank. We have scholarship funds. That's the word.
There you go.
Yeah. So we do have monthly scholarship funds. We can, for folks that you can kind of prove financial eligibility, we can usually cut that cost in half. And also for folks that are completing those first 90 days that are self-pay, then we can drop it down. The standard rate is $2,100. But again, if people need to, obviously, if they needed it initially, they'll continue to have that need for financial support, and we will work with them there as well.
I think as time goes on, our hope is to make as few barriers to financial entry into our program as possible. So, we're going to be seeking to get in network with contracts, as you talked about a little earlier, our ability to work with federal government plans and things like that as time goes on. We really want to make sure that this program is accessible to as many people as possible. And I appreciate your other question, Donna, about harm reduction as an intervention and what that looks like. And, harm reduction looks like a lot of different things for a lot of different people. But we were very deliberate on the name of our program, Colorado Medication Assisted Recovery, where the medication assists somebody's recovery. It's not necessarily the central piece of this. And I more so than the word harm reduction, I think of the word recovery and what that really means. Recovery doesn't necessarily mean sobriety or abstinence. Recovery is the journey that we're on to health and well-being and happiness, and learning to take better care of ourselves and our health care. So, does that mean that somebody needs to be completely abstinent from all mood-altering substances at all times? For a lot of us, yeah, hopefully it is. But as long as the upward trajectory of somebody's health and wellness, that's very much our goal. And I believe very much so that somebody can be on MAT, that they can take Suboxone, they're taking it as prescribed within the context of a recovery program, that they are abstinent from, non-prescribed mood-altering chemicals, that they are sober if they are taking Suboxone and are on MAT treatment. Absolutely.
Yeah, and that early intervention piece of being accessible before the jails, institutions, or death piece is 100% where we want to be intervening. Certainly, if somebody has already, if they're heading out of jail and they're going on probation, if they're coming out of the ER, we absolutely want to work with those folks. But we don't believe that that people need to wait until their first overdose or their 10th overdose, or however many relapses before they start their care with us. What we think is that everybody has a personal pathway that they need to take, and for folks who are looking for or have the need for a service that's more comprehensive, we want to be there as quickly and we want to be as available as possible right away. And we don't want people to have to go too far down the rabbit hole before they start recovering in the sort of harm reduction model that we're providing. But it's a fine line, because we ourselves are people who have abstinence-based recoveries ourselves, and we are not hardcore, the medical model is the model that works. What we believe is that the medical model has so much scientific backing that when combined with clinical work, for those where there is any real likelihood that opioid recovery with full abstinence is unrealistic or unlikely or far too complicated because of their circumstances, that even if it is, I guess, round one, that we are there for them, but that for folks who are able to go it without it, that we give them all of the support and referral resources that they need to get to one of the many incredible programs in this state and around the country that take a more abstinence-driven approach. We want to be partners in this community with as many programs as possible, and really not close ourselves off just because we ourselves might not be providing a certain service or level of care.
Right, absolutely. I think we are very aware of what we do. We provide a very specific service, and there's a lot of benefits to that, and there's also limitations to that. And if patients show up and this is their first experience with recovery, we'll do our best to assess those people and make sure they're appropriate for us and treat them. And if people turn out that they need other programs or different levels of care or different services that we offer, we're going to be making sure that they're getting set up with what they need.
Right. And just one last point, it was sort of referred to earlier that we really want to work with anybody coming into our care to get to the level of care that is appropriate to them, and not just the level of care that we provide. We are not trying to fit a square peg into a round hole. That is, in our opinion, all we're doing there, if we were to do that, is exacerbating that person's issues by not addressing things at the 24/7 level that a detox residential style provider is capable of, and we are not going to pretend to be that program. So if somebody has any of the litany of issues, use histories, mental health, co-occurring mental health issues that are out there that haven't been stabilized and haven't been addressed, we are going to make sure that they enter those levels of care prior to starting up with us, because that's recovery, right? And we're trying to live and practice the work that we're trying to preach to our patients as well.
Absolutely. Well, thank you everybody for joining us today. We really appreciate all the support and everything that we've had over the last few weeks and few months, and we're looking forward to building relationships and connecting more in the future. So everybody stay safe out there, wash your hands,
Wear masks.
and we will see you all soon.
Thank you.